Morning, General and Roach Facility. Conscious alert, 54 male. Original call was for lethargy, weakness, feeling lightheaded, dizzy. On arrival, blood pressure 90 on 60, pulse 90, stats 99%. We just stand and pivot onto our bed with a witnessed syncopal episodes. He's now, like I said, conscious and alert at this time. End tidal is 32 millimeters of mercury. Sinus on the monitor at 88 beats a minute. No ST changes. 12 leads unremarkable. Glucose is 5.2. ETA 10 minutes. Good morning, Pasqua and Roach Facility. Conscious alert. 35 female involved in a motor vehicle collision. Restrained driver. Complaining of some pain to the medial aspect of her left knee. Pain is 8 out of 10. She's vitally stable at this time. 975 of Tylenol and 500 of naproxen. ETA 5 minutes.
Hey, Pasqua, we're en route with a 54-year-old female conscious and alert. Walking out of her house today when she slipped, fell backwards, hit her head. LOC is noted. She's got a golf ball size hematoma to the back of the head with lac, controlled with pressure. Vitally, she's stable. We'll be there in about 7 minutes.
Hey, we're coming from across the street. It's a 37 female complaining of feeling dizzy. Dizziness has subsided. She was just at Taskabilities having a housing meeting when she fell asleep, I guess, mid-conversation, told them that she was feeling dizzy at that time. With us, she is a GCS 15, however, when you're not engaging her, she's falling asleep. Denies any drug or alcohol use. Pulse 68, pressure is 108 on 68, oxygen 98%. She's a sinus Brad on the monitor at 58. Some widespread T-wave inversion, otherwise it's looking okay. Sugar of 8 point something, and we'll see you in about 1 minute.
General note with 21-year-old conscious alert male. Call today, feeling panicked. On arrival, patient showing signs of alcohol withdrawal. He's a daily drinker, coming up on about 18 hours since his last drink. Quite agitated, nausea, vomiting. He did a BOS score initially about a 7. So we've IV established. He's gotten some Zofran. He's had 300 of Thiamine, and we're going ahead with 10 of Valium right now. Tachy at about 120, 12 lead unremarkable, pressure and everything else normal, and we'll see you in about 3 minutes.
In general, coming in with a conscious alert 86-year-old male patient. Chief complaint tonight, feeling dizzy and weak to the legs, can no longer walk up and get around the house. Started around 21:30 tonight. ECG came back, unremarkable sinus rhythm. Also found him with a sugar of 12.6, no history of diabetes. We are giving him 12.5 milligrams of Gravol, and we have started a line on him, just giving fluids. Vitals, pulse of 73, DP 166 on 85, stats of 98, sugar 12.6. We'll see you in about 5 minutes.
Good afternoon, Pasqua. We're on route with a conscious alert ambulatory, 66 male. Had a syncopal episode earlier today with incontinence of urine and bowels. Vitally stable stuff, sinus rhythm on monitor. 12 lead was unremarkable, and we'll see you guys in about 5 minutes.
They're coming out with a 61-year-old conscious alert female patient. Trip and fall today. Ended up landing on the ice-covered ground. Complaining of a left knee and hip pain. Dislocation, shortening and rotation. Pulses are equal bilaterally, as well as some right arm pain. No obvious crepitus or deformity noted to the right arm, but increased pain on palpation. Good equal pulses noted there. Treated so far with 150 mics of fentanyl. No relief with the pain. We got a 24 gauge IV initiated in the left shoulder. Just doing work on sore pain management. Should be there in about 5 to 10 minutes. They're coming out with a 61-year-old conscious alert female patient. Trip and fall today. Ended up landing on the ice-covered ground. Complaining of a left knee and hip pain. Dislocation, shortening and rotation. Pulses are equal bilaterally, as well as some right arm pain. No obvious crepitus or deformity noted to the right arm, but increased pain on palpation. Good equal pulses noted there. Treated so far with 150 mics of fentanyl, no relief with the pain. We got a 24 gauge IV initiated in the left shoulder. Just going to work on sore pain management. Should be there in about 5 to 10 minutes.
Hey, Pasqua, we are right around the corner with an 83-year-old constant alert male. Phoned us today due to some increased falls, weakness at home. It's been going on for approximately 3 weeks. Has 3 falls since. Does have a little bit of a hematoma to the left upper back with some minor pain on palpation. There's no obvious deformities or cryptic notice on palpation of his chest. No shortness of breath. Clear and equal bilaterally. We do have an IV established. It's just a sinus rhythm with odd PVC every now and then on the rhythm. We're going to see in about 2 minutes.
We run around an 80-year-old female patient complaining of some general weakness as well as body pain throughout her entire body. She does have bone CA, had some radiation today, and then is just unable to ambulate today due to some increased weakness. She's a little hypotensive. We're just struggling to get an IV on her. Around 84 solid. She's just 15, just an AFib on the monitor, and we'll see in about 10 minutes.
Around 67-year-old consular female has suffered fall on the ice, complaining of some severe pains to her left hip. Some shortening and rotation noted. We're treating with fentanyl right now. Well, vitals are stable. We'll see you in 10 minutes.
We are en route with a conscious and alert 25-year-old male. Post-seizure, ECOH+++. It does have a history of epilepsy. Was complaining of some nausea. He's been treated with 4 milligrams of Zofran IV and is also getting Ringer's TKO. He is vitally stable, although slightly tacky at 140, and we will see you in about 2 minutes.